Look, healthcare is incredibly important, not just here in Georgia, but in the country, that we solve these problems. I'm just getting up to speed on all the major issues, but I can tell you healthcare is a central tenet of the areas that I want to come to the Senate and strengthen in our country. I know that healthcare is not a one-size-fits-all solution, and I'm going to work hard with my colleagues to make sure that we find the right approach to healthcare and making it not just accessible, but affordable.
What are some of the things that you've seen on your trip here that have stand out to you and kind of bring around that reason as to why you want to focus on some of these areas?
Certainly the patients and the doctors. So seeing the patients, the infants in the NICU, it just touches your heart and makes you realize how critical this infrastructure is to our country, to the state of Georgia. Being able to talk to some of the patients firsthand and hear about the experience and their gratitude to the doctors really reminds you of why we're all here. In addition, just being able to talk to the doctors about their patient-centered work, their research focus, their collaboration in the community, their ability to innovate is really inspiring, and it's just great timing as I go to Washington to work on some of these challenges.
So recently you've said that you are anti-impeachment. Obviously this is going to be an issue you'll have to deal with when you get to the Senate. Would you like to see the Senate call witnesses? Would you like to see more evidence presented at the trial?
Look, I think it's important that we get back to work for our country. I don't think the case has been made for impeachment. I don't think there's evidence. I don't see a crime. But what I'm going to do is work with my colleagues in the Senate and make sure that we follow due process and as appropriate according to the Constitution, and then get back to work.
So what would you say are the biggest challenges you want to work on, if it's not this?
So there's a number of opportunities I'm going to have to impact Georgians in a positive way, whether it's through my work on the Veterans Affairs Committee, through the Ag Committee. I was raised on a farm. I know firsthand the issues that rural communities are facing. It's a myriad of issues, whether it's trade, access to broadband, some of the challenges that we have, whether it's in healthcare, certainly, in our communities. So these are the things that matter to Americans, and these are the things that I'm really focused on going to Washington to help solve for.
I understand that was in Illinois, right? That you were raised on a farm?
Yes, I was raised on a corn and soybean farm in Illinois. We had cattle as well. And I'm from the fourth generation of farmers, and our fifth generation is getting ready to return to the farm next year.
After visiting going on the tour and visiting the patients here today, and kind of like what you experienced here, what would you like for the community to know about?
Well, I think it's so important that Georgia knows the resource that is here in Augusta that's serving our entire state. And I had a wonderful conversation with Dr. Cortez about the impact of having this here means that all Georgians can live healthier lives, because as soon as you live near and you have access to these resources, your ability to live a healthy life goes up. And so they're making impacts not just on treatment, but on research and discovery about new cures. And I think that's just vital, and it should really encourage Georgians to support the efforts here.